Bill, we've had a lot of demand from our viewers to go back over several of the cases and techniques that you and I discussed and described earlier.
Okay.
One of those is your cure for migraine, which I still find fascinating. And what I'd like to suggest is that we go step by step to the migraine cure. I'll be the patient.
Okay.
And I've had migraines.
Fortunately.
35, 40 years ago, and they went away, and I can talk about that later as we get to the case. But if you could go step by step, I'll be the patient and respond to you however you direct me to do, and I'll be a participant observer and comment back to you, I don't understand why you did that, or why'd you do that, and draw out of you the details so the viewers will have a clear picture in detail of how to cure a migraine headache.
Okay, fine, Clifton. I've started out by simply introducing myself as if we were doing an audio tape or something. Mm-hmm. And I said, I'm Dr. Bill Mundy. I'm going to help you do some very meaningful and learningful things. We're going to think and imagine in some ways that will be happily healthful for you. You will be able to do easily everything that I ask of you. Migraine headaches and the symptoms accompanying them are certainly painful problems. The relief you have sought for migraines has sometimes been less than satisfactory. The headaches have continued to recur from time to time. You've been thinking for a long time about what might be causing them, and as with so many other problems in life, if you'd been able to solve the problem in your conscious awareness, you'd have already done so. Truth is, you probably did. Mm-hmm. Years past. It may be of interest to you to consider things that have not been in your awareness. You may have been a good jigsaw puzzle worker, but maybe there's some pieces under the table or some interesting pieces missing from the box. Thinking of your problem and your pain in a different way will be an interesting experience for the both of us. How nice it is to know that just thinking can be a cure for your migraines. As with so many other things that you and I have been talking about along the way, if something is mind-caused, it can be mind-cured.
You also said, and we'll remind the viewers, that what the mind doesn't deal with goes to the body, is relegated. You call it relegated to the body. So in this situation, whatever I'm not dealing with as a migraine sufferer,
exactly,
went to my body, my head.
Exactly.
As part of my body.
And
you're going to lead me to understand.
You cure the mind, you cure the body.
So you're going to lead me to the cure of the mind that then will alleviate the body.
Correct.
Okay.
So, would you be willing to take some time now, maybe just shut your eyes and think quietly, and wonder if there are certain stimuli, certain situations in your life that keep happening to which you respond with a headache. Let's just imagine this is true and think for a moment. And in order for you to keep concentrating, if I ask you a question and your answer is yes or no, just nod or just gently shake your head. So you don't have to speak if you don't want to. The events and the people and the situations need not to be exactly the same, but maybe there are certain things that cause you to feel a certain way. And that certain way begins to feel discomforting or painful. There are times when things are too uncomfortable for our minds to cope with, or it seems that there are no solutions. It's at times when we don't know what to do that we turn the problem over to our body. And sure enough, we begin to have a symptom. Again, as you stated, what the mind can't resolve will be relegated to the body. The symptoms, the pain, is our body's way of letting us know that it is having a problem also. Sometimes it helps to put your migraine into a whole different scene. If your pain were to have a color, what color would it be, Clifton?
It'd be very red.
Very red. What color would you rather have if you responded more comfortably and happily to your world?
Pale blue.
So red is the problem, pale blue, the comforting solution. Keep those two colors in mind. If I've been responding to certain stimuli with the pain color, red, I would rather respond with the happy color, pale blue. Now I'm going to ask you to do a new and interesting thing. I believe that a long time ago, when you first got your headache, and take your time thinking back, that a little part of you decided that the best choice to make in responding to your world was to let your body handle the problems. So I'd like you to just gently go inside of yourself and get in touch with that special little part of you. Go back in your mind, think way back when you first got the headache, and get in touch with that little part of you. You'll be pleased and surprised to find that you begin to notice a particular sensation in a part of your body, a change, a different feeling somewhere. You may even notice a sound or a visual image. Take your time and be aware of where you notice that new sensation. And when that occurs, just nod your head. I'd like you to know that that sensation somewhere in your body is a signal, a sign of communication between you and that little part of you. Stay inside and thank that little part for communicating with you in this interesting way. Now ask the little part if it's willing to continue communicating with you. Good. Some people may receive an increased signal from the body. Other times it's just a quiet response. If the little part is afraid, it may not be, but if so, offer it whatever reassurance is needed. Now we want to do a very special inquiry. I know that for all the time you've been having a headache, that little inside part of you has really been doing the best that he could to take care of you, even though it turned out painful and with the headache color red. Go inside again and ask the little part if it is aware of the need, the purpose, the motivations, and the reasons, the value it has in having a headache.
Mm-hmm.
Think about the possible advantage that it might be for the little kid part of you. Don't ask your grown-up intellectual part. Ask the little part, like a little child within you, the advantage that he might find.
In having the headache?
In having the headache.
Mm-hmm.
What was the advantage
Right.
that little boy had?
And I'm paying attention to this sensation I've got in my neck, which I think is the signal you're talking about.
Exactly.
And it comes on and off in response to your questions.
Exactly.
Right, okay.
Exactly.
Okay.
So you've thought about the value, the advantage in having the headache, so your mind no longer had to cope with the problem.
Right.
Ask the little part if it would like to do something different, powerful, and wonderful. When it decides yes, ask for the following information. Be sure to let the little part know that you will not criticize the answers, but will be only interested. Just listen. Ask the little part to suggest to you 3 separate and different ways to respond to the same stimuli, different than that with the pain color red. Reacting this time to ways to have the happy and successful pale blue color, and always keeping in mind the same caring purposes and successful outcomes, again, all to your advantage. This may take a little time. You have a creative part within you to help you do this. And if the little part is afraid, offer it whatever support he needs to accomplish.
I'm going back about 35 years.
Good.
At which time the headache went away, and I just went through the 3 or 4 things that changed in my life that led to the elimination of the headache. So, and they flashed up.
Perfect.
Real
So
quickly.
the stressors that you were reacting to originally were no longer present.
Right, they were eliminated. Right.
So
I moved.
when the stressors went away, your headaches went away.
Yes, instantly.
In what
Within
we're
a-
doing here, we're making an assumption that the stressors are still present, but that you find ways to dispel
Right,
those
yeah.
stressors.
I'm running a history of my headaches with my present state playing a role that I still have them. So I'm going along with this exercise as if I still have them and I'm seeking relief.
Good.
But my mind is turning back to the history of when I had them and got rid
Which
of them.
lets you re-image exactly the same thing we're dealing
Right,
with in
exactly.
today's world.
Right.
Good.